Hi, Assalamualaikum warahmatullahi wabarakatuh. I am Aida Shafia, so my team will be presenting for schizophrenia.
So, firstly, I would like to introduce schizophrenia. What is schizophrenia? Schizophrenia is basically a severe mental disorder experienced by many sufferers as a living nightmare. A fact, a fact highlighted by the high rate of suicide among the schizophrenics. This side, for signs and symptoms, divided into two, which are positive symptoms and negative symptoms. Based on the slide, I will explain about the positive symptoms. For the first one is hallucination. Hallucination is sensory experience without sensory stimulation. For the second one is delusion. Delusion is a false belief, often of persecution or grandeur, that may accompany psychotic disorders. For the third one is disorganized speech. Speech in which ideas shift from one subject to another seemingly unrelated subject, sometimes described as loosening of association. For the number four, grossly disorganized behavior and catatonia is an ability to conduct goal-directed activities, leading to behaviors that are unpredictable in appropriate situations.
Hi, back to me, Aida Shafia, so I'll be explaining for the sign and symptoms. As for the negative symptom, the first one is pattern effect, avoidation, and alogia, significant impairment in a person's functioning. And for the third one is the classification of types of schizophrenia depending upon the predominance of symptom displays, such as paranoid, disorganized, catatonic, undifferentiated, and residual type. Next, I'll be talking about factor and causes. So the first one is traumatic life, genetic, mental illness, infection, drug and toxin, prenatal health, parental ages, early disruption, migration, and social isolation.
Continue with me, Demian Shakira binti Muhammad. My metric number is 075439. I will be explaining on the treatment and management. So, firstly, for the medication is firstly we have second generation antipsychotic. Second is first generation antipsychotic, and the last one is long acting injectable antipsychotic. For second generation antipsychotic is more preferred from the doctors since they pose a lower risk or serious side effect than the first generation antipsychotic. For the example of second generation antipsychotic is acinapine, clozapine, and olanzapine. So for the first generation antipsychotic, they potentially significant of neurological side effects, including the possibility of developing a movement disorder. For example, is chlorpromazine, flu, flufenazine, and haloperidol. And the last one is long-acting injectable antipsychotic. It's given as intramuscular or subcutaneous injection, usually given every 2 or 4 weeks depending on the medication. For example, is aripiprazole, haloperidol decanoates, or and the last one is risperidone. So for the psychosocial intervention, usually uh, usually they will have an individual therapy, which is talk therapy, or also known as psychotherapy, that may help improve pattern of thought. It is also as the learning to cope with stress and identify early warning sign of the rhythm of symptoms that can help people manage their illness. Second one is social skills training. This one is focusing on making communications and social interaction better and make people with schizophrenia better and able to take part in their daily activities. Next one is family therapy. During this therapy, family member will learn on how to deal with their um, schizophrenia patient from their family members. The schizophrenia patient also can get support from their family. And the last one is vocational rehabilitation. This one is a counseling that focusing on helping people with schizophrenia to find job. So for the last part of the slide are impacts on daily life of the schizophrenia patient. Firstly, for surely they will loss of motivation. Second is they loss of interest on enjoying their daily life activity. Like they will not act like they will not act as they usually do. Next one is they will withdraw from social life. They are not interact with people and mostly they will just stay in their room. Other than that is they will having difficulty on showing emotions. Even if they are doing, even if people are doing something that they like, they will show no reaction. It's neither they are happy or sad with it. And the last one is the difficulty of functioning normally. They will have a different habits from their life before they are having the schizophrenia. So that's all from us. Thank you.